Hi, good evening. My name is Christina Smash. It is September 13th. And I'm in Bio 1030 Pathophysiology with Professor Ricketta. Bio 1030 06E for Echo. Okay. Okay, this is also the first presentation for week 2. So we have disease classifications, which would be, well, actually the first one is disease. So disease, acute chronic illness. It's acquired or you're born with this. An example of this, lymphoma, right, which affects your lymph nodes, but could also affect all parts of your body because it weakens your immune system, your white blood cells. Next one. The next one we have is disease classifications, which is defined as topographic, body, region, or system, anatomic by organs, tissues, physiological function, pathological nature of disease, etiological, which is causal. Examples in this order would be gastro, heart, gout, pneumonia. Then we have etiology, which is the cause of disease, disease-causing agents, causes multiple diseases, and examples are biological agents, virus, fungi, genetic inheritance. Pneumonia can be caused by smoking or bacteria. It depends on what you're doing as an individual, touching stuff or smoking. Next thing is pathogenesis, which is the initial contact to expression of the disease. Initial contact, like when the disease enters your body, right? Or an example of this is a cold. It's expressed by sore throat, runny nose, and then your body starts to fight it off, right, with your immune system, and that's just pretty much the length of time that it takes for your body to heal itself after it was like initially infected with that. Then we have symptoms. Symptoms, they cannot be measured. That's important to know about them. So a symptom is what I tell the doctor about how I feel today. I have a headache, I have a stomachache, cramps, like dizziness. The doctor or nurse practitioner or medical assistant or whoever it is taking the notes and things like that, they're going to go based off of what the patient is telling you. Then we have signs. Signs are objective. These things can be measured. So when you go to the doctor and they do like your vitals, they're measurements, right? So temperature, blood pressure, they listen to your heart, the respiration, oxygen, all those things are measured and they are signs. Then we have syndromes. Syndromes are combinations of signs and syndromes that are characteristics of the disease. They occur together. An example of them would be, many women have this. We have IBS, irritable bowel syndrome. Symptom of this would be like bloating, belly discomfort, constipation, right? IBS. It's like, it's interesting because diseases that IBS, it can end up like developing Crohn's disease, chronic diarrhea from infections, like if you've got parasites or a worm or something. When you have a syndrome, you and your clinician, doctor, PA have to like get together, rule out everything that can be related to that, right? Related to that disease or specific disease, or with the specific causes, with specific treatments, so that hopefully you can like get better. Then we have diagnosis, which is like identification of a nature of a disease that you may have. When you're diagnosing things, you may look at medical records, signs, symptoms, observations, physical tests, labs, x-rays. An example of this would be COVID. Two people live in the same house. One person has it, one person doesn't. The one person that doesn't have it comes into the doctor's office, the person that doesn't, and they are complaining, right? I had trouble breathing, fluid in my lungs. When the doctor listens, when you see that too, right? And as a doctor, when you listen to it, you may be suspicious that they have COVID because the person that they're living in the house may have it, or maybe they just have a regular cold or pneumonia or something. But when you test the person, it comes back positive for COVID. That's the diagnostics. Complications. They're like unfavorable results of a disease or health condition or treatment. We see these complications all the time, every day in our daily life. Everything that you purchase, they probably have a complication. But a modern day example would be Tylenol, Excedrin. You always see complications on the back of them. For example, kidney issues, which can cause kidney failure if they stop functioning properly. End up with a prognosis and outcome of having to be on dialysis, which can cause other complications and manifest itself in other ways in your body, because other bodily systems may start to break down, and cause you to break down over time, unfortunately. Prognosis is a probable outcome or chance of recovery, survival rates, things of that nature. Chance you can recover, a chance you can recover with complications, a chance you can't recover at all. That's an example of prognosis. Or a doctor may tell you you have 5 months to live. That's a prognosis. Those are the outcomes. Chance of recovery. Then there's diagnostic tests, the type of tests used to diagnose a test or disease. When we get mammograms, it's an x-ray of our breasts, and we use it to see if we have breast cancer. I hope you enjoyed my presentation. Have a good day.